Yeah,
Great.
great.
Again, good morning, everyone. My name is Sherita Mullins, and I am the Director of Supportive Services for Burten Carr Development. Today, I was given the task to give my perspective on the role of community development corporations, what role we have in public health. To answer this question up front, we are still defining our role in public health and identifying ways that we can influence health outcomes in the neighborhoods we serve, which are historically red line communities. For level setting, I will provide a brief history of the community development industry and an overview of Burten Carr. So community development dates back to the 1970s in Cleveland. Back then, the sole mission was stabilizing the lives and residencies of low-income people. As more CDCs expanded throughout the city, the core missions included community organizing, political advocacy, and helping to give residents a voice in local government. So Burten Carr Development, we are a nonprofit community development corporation founded in the 1990s that serves Cleveland's Central, Kinsman, and Buckeye neighborhoods on the east side of Cleveland. Our mission is to empower citizens and revitalize blighted and underserved communities. We revitalize communities through neighborhood planning and engagement, residential and commercial development, and supportive services. Early on, we focused our efforts on restoring the residential fabrics of our neighborhoods. In Central, we played a major role in the development of over 700 homes. Last year in Kinsman, we completed an infill housing project, which provided 36 families with affordable lease-to-purchase opportunities. We own and manage 4 retail centers, including our most recent acquisition of Shaker Square in the Buckeye Shaker neighborhood in partnership with the Cleveland Neighborhood Progress. In the past 10 years, our work has evolved, including our impact in the areas of workforce, small business, health and wellness, green space, education, public art, and youth development. Community development encompasses a cross-section of relationship and trust building, fundraising, advocacy, transparency, empathy, and service delivery, to name a few. Working in each of the neighborhoods we serve presents a multitude of challenges that are unique and complex to each area and resident we assist. For example, both the Kinsman and Central neighborhoods are considered food apartheids, yet the Buckeye neighborhood has 2 grocery stores. And residents in all 3 neighborhoods express the need for access to fresh produce. So knowing the landscape and challenges of each neighborhood is a necessity to determine which projects and initiatives to focus on or advocate for on the behalf of the residents we serve. We are aware of the health inequities and the lack of trust between residents and health institutions. So in turn, we have to assume the role of a connector and convener between residents and resources that address their physical health and the social determinants of health that impact every area of their lives. Today, I have 4 examples of how we have responded to the public health needs of our residents. To address the food insecurity in our service area, we designed and implemented the Healthy Food Access Initiative. Through this initiative, we offer no-cost health screenings, nutrition education, and healthy cooking classes to residents of Cleveland. This is an interdisciplinary approach incorporating professional chefs and health experts from partner organizations. The classes focus on creative meals that meet the requirements of particular diagnoses such as obesity, inflammation, hypertension, gout, you name it. Along with a detailed meal plan, participants are provided with long-lasting tips and resources to successfully implement a healthy living routine into their daily lifestyles. Healthy Eating, Active Living, Heal is a national framework that we have adopted as a local network. For us, it is a collaborative effort with the support of the Sisters of Charity Foundation, local and state agencies, and community partners to have an impact on health, economic opportunities, and the quality of life of Central and Kinsman residents. The mission of the network is to better align food access and health-oriented programs in schools, work sites, food outlets, and other community assets. As the backbone organization of HEAL, we provide support to both partner institutions and community residents to support the mission of the HEAL network, offer opportunities for collaboration, and enhance the delivery of food access programs. Our initial response to the COVID-19 pandemic was to provide direct needs to residents such as PPE, warm meals, and produce. We assisted over 3,000 residents in the first year. Then we transitioned to providing education and access to the vaccine. With the support of the St. Luke's Foundation and the Rapid Response Fund, we developed an education campaign where residents were trained to speak with residents about COVID-19 and dispel the myths on the vaccine. We also partnered with Care Alliance to host vaccine clinics throughout the 3 neighborhoods. Last, I want to speak about our Community Health Needs Assessment, or CHNA. For us, it's the process we use to identify the top social determinants of health needs concerning residents in the Buckeye, Kinsman, and Central neighborhoods. We conducted a survey using a creative community engagement approach and received over 1,400 resident responses. The CHNA was a collaborative effort with BBC, Old Brooklyn Community Development, the Mary Ann Swetland Center for Environmental Health, United Way, and Better Health Partnership. Data identified from this assessment will help us create a health agenda for each of our neighborhoods and advocate for resources, programs, and funds to address the health inequities in each neighborhood. So we're analyzing the data now, and we hope to release and report out back to stakeholders, funders, and neighborhoods of the results in April and May. And then we look forward to the implementation phase after that. So thank you. That concludes my presentation.
Thank you, Sherita,